Hi guys, what's up? Welcome back. I'm Shiv Virmani, Indian medical student and author of the book Pharmacology, and welcome back to the Unacademy, the best online learning platform. And we are here, and we'll be studying. So this is the basically continuation class. Uh, yeah, we are live again. We are live now, I think. Yeah, we are live now. So guys, first of all, this is the continuation session of our previous video or our previous session. So in this we will be completing the CNS drugs जो हमने छोड़ा था पीछे. So if you have attended the session, then you must be knowing that we have completed the anti-epileptic drugs, then we have also completed the anti-Parkinsonian drugs, and now we will be starting from antipsychotic drugs, and then we will be doing anti-manic, antidepressive, anti-anxiety, and opioid analgesics प्लस सेडेटिव हिप्नोटिक्स. सो पहले हम ये सब चीज़ें ख़त्म करेंगे, देन हम जाएंगे GIT पर, एंड देन हम जाएंगे ब्लड पर. ठीक है. सो बेसिकली जो हमारा थंबनेल है दैट इज शोइंग द GIT एंड द ब्लड, बट एज हमारा लास्ट सेशन में कंप्लीट नहीं हो पाई थी चीज़ें, सो वी विल बी कंटिन्यूइंग दिस and we'll be completing the things here, right? So I hope this thing is clear to you. So welcome back to the top online learning platform, that is Unacademy. And here in this slide you can, so here this slide tells you how to download the Unacademy app. This you all must be knowing that you have to write Unacademy in the search section, and you can search this app and you can install it from App Store and Play Store. It's a very easy process, and you don't have to pay any thing. You don't have to pay a single penny, and right. So आपको कुछ भी नहीं देना है, कुछ भी पे नहीं करना है, and so we are having the top level of educators here from the best and the top esteemed universities of the India, and these educators are having their teaching experience around more than 10 hours and more, right? And we are having two choices: if you want to buy plus course, and if you want to buy or if you want to subscribe to Unacademy, then we are having these two courses. One is plus and the other one is iconic. First of all, plus course. So is plus course. Plus के अंदर you get access to the whole Unacademy. You can attend any class, you can attend any session, you can enroll yourself into the batch courses, you can attend the test, you can attend the quizzes, and you get the structured schedule, you get the deadline, you get the main strategy, and that's the most important thing. Then iconic course. Iconic में basically it is the iconic is the collaboration of Unacademy with the Prep Ladder. So here you get all the benefits of the Unacademy, and सारे Unacademy के benefits तो आपको मिलेंगे ही, then Prep Ladder को भी आपको benefit मिलेगा, and wait a second, and yeah, so आपको Unacademy के सारे benefits मिलेंगे, एंड इसके साथ आपको प्रेप लैडर की प्री रिकॉर्डेड वीडियो लेक्चर्स भी देखने को मिलेंगी, एंड क्यूबैंक 2.0 भी आप देख सकते हो. रैपिड रिवीजन कोर्स को भी आप यू गेट द रैपिड रिवीजन कोर्स 2.0 एंड यू गेट द हैंड रिटन नोट्स एज वेल. So these are the benefits of the plus and iconic, right? Wait a second. Yeah, so I hope कि अब हम आगे चलते हैं. So if you buy the iconic, then you are having 4 choices. You can buy it for 12 month, you can buy it for 18 month, you can buy it for 24 and 36 month, and that's the main 4 choices of this iconic. But the NEET PG जो plus का subscription है, it's having many choices. You can buy it for 1 month, you can buy it for 3 month, you can buy it for 6 month, you can buy it for 12 month, you can buy it for 18 month, 24, 36, and yeah. So काफ़ी ज़्यादा choices हैं इसके अंदर. And even if you want to test that Unacademy is beneficial for you or not, that is beneficial, but just to clear your doubt, you can buy it for 1 month, and you can clear your all doubts, and you can upgrade it to 12, 36 and 24 month as per your need and as per your choice. And if you want to buy, then code is Virmani, and you will be getting 10% off, and you will be getting 10% off, and code is VIRMANI, right? So let's just move forward. So here we are not studying Bethonian, here we are studying the pharmacology. And हमने एंटी एपिलेप्टिक कर लिया, एंटी पार्किंसोनियन कर लिया, and now we are about to do the anti-psychotic drugs. So guys, this was the Pharmac Easy series that we have started around in October, and this was the very beneficial and very loved series, and सबको पसंद आई थी because ये एक अलग ही blend था, and this was the blend of our what I am saying, this was the blend of medicine, physiology and pharmacology. So basically ये आपके लिए बहुत ज़्यादा benefit था, and that's why आप सबको पसंद भी आया. इससे हमने प्रिस्क्रिप्शन कैसे लिखना है अच्छे से, देन हमने कैसे पेशेंट को देखना है, क्या क्या एडवर्स इफ़ेक्ट्स हैं, सब कुछ अच्छे से डिस्कस करा था. सो बहुत ज़्यादा मेहनत लगी थी इसका मटेरियल रेडी करने में, एंड जब भी कुछ काम बहुत ही ज़्यादा मेहनत से करो, देन यू गेट सक्सेसफुल. एंड दस बहुत ही ज़्यादा पसंद आया था आपको, राइट? एंड थैंक यू सो मच फॉर दैट. एंड काफ़ी ज़्यादा सेशंस हुए थे उस पे, और हमने काफ़ी ज़्यादा तरीके से काफ़ी ज़्यादा सेशन, काफ़ी ज़्यादा टाइम पीरियड में वो चीज़ कंप्लीट करी थी. बट ये एक रन अप सेशन है, मैराथन सेशन है. इसके अंदर वी विल बी ट्राइंग टू डू वेरी फास्ट रिविजन ऑफ होल CNS एंड होल फार्माकोलॉजी बेसिकली, right? So let's just move further, and let's just do the things. So here we will be studying the antipsychotic first of all. So guys, mental illness is divided into two: neurosis and psychosis. Psychosis is a disorder in which reality is lost, and neurosis is a disorder in which reality is not lost. So psychosis में क्या होता है, reality lost नहीं होती. साइकोसिस में क्या होता है, रियलिटी इज़ लॉस्ट, मतलब पेशेंट अपने साथ गलत कर रहा है, अपने साथ सही कर रहा है, उसको नहीं पता चलेगा, पेशेंट को कुछ नहीं पता चलेगा. इवन इफ ही और शी इज़ डूइंग रॉन्ग, उसको नहीं पता चलेगा कि वो कुछ गलत कर रहा है, न्यूसेंस कर रहा है या इधर उधर चीज़ें फोड़ रहा है, नहीं पता चलेगा पेशेंट को कि वो रॉन्ग कर रहा है या नहीं कर रहा, वो सही कर रहा है, ठीक है. बट इट इज़ नॉट द केस ऑफ न्यूरोसिस. न्यूरोसिस में पेशेंट को पता है कि वो क्या कर रहा है, पेशेंट को उसकी रियलिटी पता है कि व्हाट इज़ ही डूइंग और व्हाट इज़ ही फेसिंग. एंड दस जो न्यूरोसिस है, इसका प्रोग्नोसिस इज़ बेटर, इज़ गुड. एंड जो साइकोसिस है, उसके अंदर जो प्रोग्नोसिस है, दैट इज़ नॉट गुड, बिकॉज पेशेंट लॉस्ट हिज और हर रियलिटी. और एक बार रियलिटी लॉस हो जाती है ना, देन पेशेंट को पॉजिटिव और नेगेटिव पता नहीं चलता. अगर पेशेंट को पॉजिटिव और नेगेटिव पता चले, अगर पेशेंट को पॉजिटिव और नेगेटिव पता चले तो उसको खुद ही ट्रीटमेंट मिल जाएगा अपने डिसऑर्डर्स का, राइट। बट एज सच साइकोसिस में रियलिटी लॉस हो जाता है तो उसको अपने डिसऑर्डर्स का पॉजिटिव और नेगेटिव नहीं पता चलता, और दैट्स वाई दिस प्रोग्नोसिस इज पुअर एंड काउंसलिंग अलोन कैन नॉट हेल्प इन साइकोसिस एंड काउंसलिंग अलोन कैन हेल्प in the neurosis. So yeah, that's the main benefit, right? And yeah, so I hope कि अभी तक आप सबको समझ में आया होगा, राइट? समझ में आया है तो एक थम्स अप दे दो फटाफट से, एंड सब राइट। लेट्स सी द लाइव चैट। सो गाइज जो भी साइकोसिस है इन दैट मेन इज साइजोफ्रेनिया। साइजोफ्रेनिया और द वेरियस मूड डिसऑर्डर्स, मेनिया, डिप्रेशन, मैनिक डिप्रेसिव साइकोसिस, बाइपोलर डिसऑर्डर एंड वेट अ सेकेंड। हेलो, हाँ ठीक है, तो 5-10 मिनट लगेंगे ना? नहीं नहीं नहीं, एक नंबर नहीं है। हाँ मैं इनको भेजता हूँ, ठीक, ओके। सो साइजोफ्रेनिया, mood disorders, mania, depression, manic depressive psychosis and bipolar disorder, right? And this is the condition in which dopamine is increased. Is increased, right? Wait a second. एंड न्यूरोसिस के अंदर क्या क्या है? एंजाइटी, फोबिक डिसऑर्डर्स, ओसीडीज एंड रिएक्टिव डिप्रेशन, बुलीमिया, पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर एंड साइजोफ्रेनिया के अंदर एज आई हैव सेड कि डोपामिन की कंडीशन डोपामिन ज़्यादा है। देन डोपामिन अगर ज़्यादा है तो ट्रीटमेंट क्या होगा? ट्रीटमेंट यही होगा कि वी वांट टू डिक्रीज द डोपामिन हियर, we want to decrease the dopamine here, right? I hope you all have understood. Then so treatment होता है antipsychotic drugs. So सबसे पहले antipsychotic drugs में they are divided into two, typical and atypical. Typical antipsychotics are D2 blockers and atypical ones are basically atypical ones, they are potent 5-HT2 antagonists but they are weak D2 blockers, right? So typical में haloperidol, trifluperidol, flufenazine, chlorpromazine, thioridazine, thiotixine and chlorprotixine. So haloperidol, trifluperidol, flufenazine, they are strong D2 receptor blocker, and thiotixine and chlorprotixine, they are intermediate D2 receptor blocker. Then chlorpromazine and thioridazine, they are weak D2 receptor blocker. So these are the typical antipsychotic drugs. Atypical की अगर मैं बात करूँ, then they are potent 5-HT2 antagonist. So clozapine, olanzapine, quetiapine, asenapine, zotapine, risperidone, paliperidone, iloperidone, riptrazidone and lurazidone. So these are all the atypical antipsychotics, right? So first of all, let's discuss the typical antipsychotic drugs. So typical antipsychotic drugs के अंदर फर्स्ट ऑफ ऑल एक्शन CNS पर इसका नॉन साइकोटिक एक्शन, पॉजिटिव टू द थॉट, साइकोमोटर स्लोइंग, इमोशनल क्वाइटनिंग, देन रिडक्शन इन द इनिशिएटिव, देन एक्स्ट्रा पिरामिडल मोटर साइड इफेक्ट्स एंड न्यूरोलेप्टिक सिंड्रोम, प्लस these will be basically slow down, so all the effects will be slow down. एंड साइकोसिस, सो ये सब नॉन साइकोटिक नॉर्मल पेशेंट में होगा, बट साइकोटिक्स के अंदर देर विल बी रिड्यूस्ड इरेशनल बिहेवियर, एग्रेशन, एजिटेशन, हाइपर एक्टिविटी, हेलुसिनेशन एंड डिल्यूजन. सो दीज आर द psychotic, these are the CNS effects that is there in the psychotics, ठीक है. Then significant for the decrease in the seizure threshold, chlorpromazine, loss of the temperature regulation, blockade and D2 and block CTZ, that will be causing NTMSs or antiemetic effect, then potent local anesthetic effect, then increase the prolactin release. So here you should understand that prolactin is inversely proportional to the dopamine. So if dopamine is increasing, then prolactin will decrease, and if dopamine is decreased, then prolactin will increase, right? So there will be increase in the prolactin release, and this will depress the heart. Then the drugs, first is haloperidol. The most commonly used typical antipsychotic is the haloperidol, and it is indicated for the acute schizophrenia, Huntington's disease, Guillain-Barré syndrome, and plasma T half-life is 24 hours, and it is less leptogenic, and weight does not cause any and it does not cause any weight gain. Haloperidol does not cause any weight gain. So haloperidol is most commonly used typical antipsychotic, and it is indicated for the acute schizophrenia, Huntington's disease, Guillain-Barré syndrome. Plasma T half-life is 24 hours and less elliptogenic, and it does not cause any weight gain. Trifluperidol is basically more potent than haloperidol, and flufenazine and triflufenazine is a highly potent drug, and they are less elliptogenic, and they does not cause any hypotension or sedation, and they are indicated in uncooperative psychotics. Then thyroidazine के अंदर they are basically lower potency, they are of lower potency, and marked central anticholinergic action is produced. Side effect की बात करूँ, then extrapyramidal side effects are low, and cardiac arrhythmias and sexual function interference is there. Then triflupromazine, so they are indicated mainly as antiemetic, and side effect is basically acute muscle dystonia in the children. Then side effects so primary side effect is extrapyramidal symptoms. Extrapyramidal symptoms के अंदर patient will be having dystonia, akathisia, Parkinsonism, tardive dyskinesia, malignant neuroleptic syndrome. So these are the extrapyramidal symptoms. And what are the treatment of these side effects? Benzhexol is the central anticholinergic, and this is the treatment for dystonia, Parkinsonism, akathisia, malignant neuroleptic syndrome. And valbenazine is a VM82 inhibitor, and it is used for the tardive dyskinesia. Propranolol is the drug of choice for akathisia. Dantrolene is used for the malignant neuroleptic syndrome. Then hyperprolactinemia. So D2 will be decreasing the prolactin, and D2 blockers will be increasing the prolactin. Hyperprolactinemia. D2 will be decreasing the prolactin, and D2 blockers will be increasing the prolactin. And acetylcholine inhibitors की वजह से dryness of, so these blocks acetylcholine as well. So ये चीज़ आप लोगों मैंने बता दी थी कि हाइपरप्रोलैक्टिनीमिया अगर होगा, हाइपरप्रोलैक्टिनीमिया है तो बिकॉज ऑफ देयर इज डेफिशिएंसी ऑफ द डोपामिन. देन एसिटाइलकोलिन ब्लॉकेड की वजह से ड्राइनेस ऑफ माउथ एंड ब्लरिंग ऑफ विजन. एल्फा ब्लॉकिंग की वजह से डिक्रीज इन द बीपी. H1 ब्लॉकिंग की वजह से सेडेशन. डिक्रीज इन द सीजर थ्रेशोल्ड विल प्रेसिपिटेट द सीजर्स, राइट. And second is atypical antipsychotics. 5-HT2 blockers, the weak D2 blocker. Wait a second guys. Then atypical antipsychotics, so these are mainly 5-HT2 blocker, 5-HT2 blocker, and they are having lesser side effects. And drugs की अगर मैं बात करूँ तो clozapine is the drug, and it is used or indicated for the resistant schizophrenia, and it does the sedating, alpha blocking, 5-HT2 blocking, and D2 blocking. And it will produce a positive and a negative symptoms. and both the positive and the negative symptoms are improved. Then side effect की अगर बात करूँ तो metabolic complication are there. It will be causing weight gain, it will be causing hyperlipidemia, it will be causing diabetes mellitus precipitation. Then there will be sedation, sialorrhea, agranulocytosis, seizures and myocarditis. Then Qutapin causes cataract, and risperidone is maximum D2 blocking properties, having the maximum D2 blocking property and extrapyramidal symptoms, and there will be increase in the lactic acid. Then ziprasidone, it will be causing the prolongation of the QT interval, and thus it will be causing the torsades de pointes. Pivenserin is the drug that blocks the 5-HT2 receptor, and it is approved for the Parkinsonism induced the mental anomalies and psychosis. Aripiprazole is your unique drug, and it is a partial agonist at D2 and 5-HT1A receptor and antagonist at 5-HT2 receptor. So atypical antipsychotics is a 5-HT2 blocker and weak D2 blocker, and it is having lesser side effects. Clozapine की बात करें, then it is used for the resistant schizophrenia. It is indicated, or it is the drug of choice for the resistant schizophrenia, and जो इफेक्ट प्रोड्यूस होंगे वो होंगे सेडेटिंग की वजह से, सेडेशन अल्फा ब्लॉकिंग की प्रॉपर्टी से, 5-HT2 ब्लॉकिंग और D2 ब्लॉकिंग, एंड बोथ द पॉजिटिव एंड द नेगेटिव सिम्टम्स आर इम्प्रूव्ड. Then metabolic complications, weight gain, hyperlipidemia and diabetes mellitus precipitation, sedation, sialorrhea, agranulocytosis, seizures and myocarditis. Then Qutapin causes cataract, and risperidone is having maximum D2 blocking property and extrapyramidal symptoms and increase in the lactic acid. Because maximum D2 blocking है तो maximum D2 deficiency हो जाएगी और high prolactinemia हो जाएगा. Then ziprasidone causes prolongation of the QT interval, torsades de pointes, and pimavanserin, it blocks the 5-HT2 receptor, and it is approved for the Parkinsonism induced mental anomalies, that is psychosis. Aripiprazole is a unique drug, and it is partial agonist at D2 and 5-HT1A receptor, and it is antagonist at 5-HT2. Then uses of antipsychotic drugs. So antipsychotics are used for antiemetic, antimanic, antipsychotics, and Huntington's chorea के लिए भी यूज़ होती है, and tic disorder, that is Gile-de-la-Tourette syndrome में भी यूज़ होती है. But the drug of choice for both the Huntington's chorea and the Gile-de-la-Tourette syndrome के लिए the drug of choice is tetrabenazine. ठीक है. I hope it is clear. Then let's just move towards the antipsychotic हो गया. Now let's do the wait a second. एंटी एपिलेप्टिक हो गया, एंटी साइकोटिक, एंटी पार्किंसोनियन हो गया, एंटी मैनिक ड्रग्स. सो नाउ लेट्स डू द एंटी मैनिक ड्रग्स. फटाफट से एंटी मैनिक डिस्कस करते हैं. सो गाइज, एंटी मैनिक ड्रग, मूड डिसऑर्डर्स को हमने अच्छे से डिस्कस कर लिया था. सो 3 टाइप्स में है मेनिया. सो इट इज़ डिफरेंशिएटेड इन द 3 टाइप्स, मेनिया, डिप्रेशन एंड बाइपोलर डिसऑर्डर. So first of all, mania. Mania is the irritable mood, reduced sleep, hyperactivity, uncontrolled thought and speech. So this is a mania, and for this we are having anti-manic drugs. So what is the mechanism of mania? So mania कैसे होता है? So mania कैसे होता है? Mania occurs due to the overactivity of the neurotransmitters in the brain. Overactivity of the neurotransmitters in the brain. फर्स्ट ऑफ ऑल न्यूरोट्रांसमीटर देखो, विच इज स्टिमुलेटेड बाय द कैल्शियम. कैल्शियम से स्टिमुलेट होगा, जी प्रोटीन कपल रिसेप्टर को स्टिमुलेट करेगा, जी क्यू प्रोटीन को स्टिमुलेट करेगा. देन PIP2 विल बी कन्वर्टेड टू द IP3 DAG. IP3 विल बी कन्वर्टेड टू द IP2 विद द हेल्प ऑफ फॉस्फेटेज एंजाइम. अगेन फॉस्फेटेज की वजह से IP2 IP में हो जाएगा. IP विल बी कन्वर्टेड टू इनोसिटॉल. इनोसिटॉल जाएगा, फॉस्फेटिडाइल इनोसिटॉल बनेगा, एंड फॉस्फेटिडाइल इनोसिटॉल विल बी कन्वर्टेड टू PIP2 एंड PIP एंड देन PIP2 अल्टीमेटली. एंड ये जो तो क्या होता है कि इन दिस मेनिया, ये जो फॉस्फेटेज है ना, ये फॉस्फेटेज की या तो डेफिशिएंसी हो जाती है, या फिर ये यहाँ जो कैल्शियम है ना ये काफ़ी ज़्यादा बढ़ जाता है। फॉस्फेट की डेफिशिएंसी नहीं, फॉस्फेट की अमाउंट बहुत ज़्यादा बढ़ जाती है। तो फॉस्फेट की अमाउंट बहुत ज़्यादा बढ़ जाती है ना, तो ये साइक्लिक प्रोसेस बहुत जल्दी जल्दी चलता है। एंड ये साइक्लिक प्रोसेस बहुत जल्दी जल्दी चलता है, तो ये कैल्शियम रिलीज़ करता जाएगा। ये कैल्शियम रिलीज़ करता जाएगा तो न्यूरोट्रांसमीटर रिलीज़ होता जाएगा, राइट। और लिथियम इज़ द ड्रग दैट इज़ यूज। और लिथियम क्या करता है, लिथियम इस फॉस्फेटेज को बैन ब्लॉक कर देता है। और ये फॉस्फेटेज अगर ब्लॉक हो गया ना, देन क्या होगा, ये जो प्रोसेस है ये स्लो हो जाएगा, स्लो हो जाएगा और कम हो जाएगा। उसकी वजह से जो कैल्शियम रिलीज है वो कम रिलीज होगा, और दैट्स व्हाई न्यूरो ट्रांसमीटर जो है वो कम धीरे धीरे रिलीज होगा या फिर कम रिलीज होगा, राइट। देन ड्रग्स फर्स्ट है लिथियम, सेकंड इज एंटी कन्वल्सेंट, एंड थर्ड इज एटिपिकल एंटीसाइकोटिक्स. सो वी कैन यूज 3 drugs. First is lithium carbonate, that is the drug of choice. And second drug is anticonvulsant, and valproic acid, CBZ, and lamotrigine. Atypical antipsychotic है olanzapine, risperidone, and quetiapine. Then lithium carbonate is the drug that is established as a standard anti-manic and mood stabilizing drug. And इसके actions की अगर बात करें, then CNS has practically no acute effects and neither sedative nor euphoriant, but a prolonged administration acts as mood stabilizer in the bipolar disorder. And a continued treatment prevents cyclic mood changes. So सबसे पहले लिथियम, इट इज़ एस्टैब्लिश्ड एज अ स्टैंडर्ड एंटी मैनिक एंड मूड स्टेबलाइजिंग ड्रग. एंड एक्शंस की बात करूँ तो इट हैज़ प्रैक्टिकली नो एक्यूट इफेक्ट्स and neither sedative or nor euphoriant, but a prolonged administration acts as mood stabilizer in the bipolar disorder, and a continued treatment prevents cyclic mood changes. Plasma concentration की बात करूँ, then acute mania is 0.8 to 1.2 milli equivalent per liter. So plasma concentration चाहिए अगर acute mania के अंदर, then prophylaxis के अंदर 0.5 to 0.8, and toxic हो जाएगी अगर this increase to 2 milli equivalent per liter, 2 milli equivalent per liter, ठीक है, 2 milli equivalent per liter. Then pharmacokinetic, well absorbed orally, neither protein bound nor metabolized, and penetrates the brain. CSF concentration of lithium is half to that of the plasma concentration, and excreted by the kidney, same as Na. So lithium is also Li plus and Na plus, same family. So it is excreted by the kidney, same as Na. And after a single dose, urinary excretion is rapid and followed by the much slower phase. And on repeated medication, steady state concentration is achieved. Adverse effect की अगर बात करूँ, then lithium is having its adverse effects as lithium only. Then lithium, स्पेलिंग क्यों गलत लिख रहा हूँ मैं, लिथियम, ल्यूकोसाइटोसिस, इंक्रीज ट्रेमर्स, हाइपोटेंशन, हाइपोथायरॉयडिज्म, गटर, देन इंक्रीज यूरिन polyuria, polydipsia, avoided in mothers in pregnancy because of Epstein anomaly, plus it will be causing vomiting, nausea, and diarrhea. It will be causing CNS toxicity. It will be causing ataxia, giddiness, delirium, coma, convulsions, and contraindicated in the sixth sinus syndrome, reduction in the T wave, SA, and the AV node is depressed. And uses of the lithium. Uses of the lithium, acute mania में response is slow, preferred as atypical antipsychotic drug, oral or IM, plus benzodiazepine, and then start lithium after the episode is under control. Then bipolar disorder, it lengthens the interval between the cycles of the mood swings, then depression and neutropenia. So these are the indications of the lithium. Then alternatives to the lithium, we can start the valproic acid. So valproic acid, high doses of the valproic acid is first line drug of mania, and it is faster than lithium. Devalproic, it is complex for the valproic acid for better gastric tolerance, and valproate plus atypical antipsychotic is the acute mania, and that's why it is highly efficacious, and it is effective in prophylaxis of the bipolar disorder. And carbamazepine is less effective than lithium or valproate, and high doses of carbamazepine produce neurotoxicity and are poorly tolerated. And lamotrigine is the prophylaxis of depression and bipolar disorder. And atypical antipsychotics: olanzapine, quetiapine, risperidone plus benzodiazepine. First line drug therapy in the acute mania is there, and so this is the first line drug therapy in the acute mania. And aripiprazole is the favored drug for the treatment of mania as well. Then olanzapine is approved for the maintenance therapy of the bipolar disorder. Both manic and depressive states are suppressed, and long-term therapy is the long-term therapy with this drug is having a higher risk of weight gain and hyperglycemia. And now let's do the manic is also done, and antidepressant. So guys, antidepressant drugs. So what is happening here is depression मतलब mood disorder that is characterized by persisting sadness and a lack of pleasure and interest in the previously pleasurable activities, feeling of worthlessness, guilt plus suicidal thoughts. Then cause: deficiency of the monoamines is basically what is the etiology of depression? Due to the deficiency of the monoamines, that is 5-HT की deficiencies है. Then deficiency of the BDNF, brain derived neurotropic factor, and there is a decrease in the MA, there is decrease in the BDNF, decrease in the neuroplasticity, and thus it is leading to the depression. So 5-HT की deficiency हो गई. 5-HT बेसिकली क्या है? 5 तो हम बढ़ा कैसे सकते हैं? 5-HT monoamines, how we can increase? We can increase it by blocking the reuptake, or by blocking the metabolism, or by increasing the 5-HT. ठीक है. Then first of all, to reduce the metabolism. So guys, aim of the treatment is to increase the 5-HT, and here we are having typical antidepressants, and typical antidepressants they are divided into two. First is to reduce metabolism, and the other one is to reuptake inhibitor. So first is to reduce metabolism and to inhibit the reuptake. So to reduce the metabolism, first is MAO inhibitors, and the drugs were moclobemide and chlorgilline. So moclobemide is also called as रीमा, और क्यों कहते हैं वो अभी बताऊंगा, और अगर आपने पहले का अटेंड कर रखा है देन आपको पता होगा. So reuptake inhibitors, they are non-selective 5-HT and NA. So non-selective, so they will be basically inhibiting the reuptake of the 5-HT and NA. So we are having here TCAs, tricyclic antidepressants, and the drug is imipramine, desipramine, clomipramine, amitriptyline and nortriptyline, right? So imipramine, desipramine, clomipramine, amitriptyline and nortriptyline. SNRIs are venlafaxine, desvenlafaxine, milnacipram, levomilnacipram and duloxetine. So these are the SNRIs, right? So ये क्या है? ये दोनों क्या करेंगी? ये 5-HT और NA दोनों के ही रीअपटेक को ब्लॉक करेंगी, राइट? सो दोनों का ही अमाउंट बढ़ाएंगी. देन वी आर हैविंग selective 5-HT reuptake inhibitors as well, SSRIs, and here we are having fluoxetine, paroxetine, fluoxamine, citalopram, escitalopram and depoxetine, and this is for the premature ejaculation. Depoxetine is used for the premature ejaculation. Then atypical antidepressants act by other mechanisms, and the drugs first, so the जो drugs जो हैं that is divided into first typical antidepressants act by increasing the 5-HT, and MAOA inhibitors. So first is moclobemide, and we also called as REMA because it is a reversible inhibitor of MAOA inhibitor. So MAOA enzyme. So because it is a reversible inhibitor of MAOA enzyme, and short duration of action is there, no dietary restriction are required, and lacks of the anticholinergic action, safer in overdoses, safe in elderly and in heart diseases as well. Then adverse effect: nausea, dizziness, headache, insomnia, rare excitement, and liver damage. Then non-selective reuptake inhibitors, tricyclic antidepressant, that is blocking in the reuptake of 5-HT and Na. So they are called as first generation antidepressant and should be avoided in hypertension, angina, and MI. Then drugs: imipramine, desipramine, clomipramine, amitriptyline, and nortriptyline. So these are the drugs and these are the non-selective reuptake inhibitors. मतलब ये दोनों को बढ़ाएंगे, 5-HT को भी बढ़ाएंगे और Na को भी बढ़ाएंगे. एंड फर्स्ट क्या है? फर्स्ट है ट्राईसाइक्लिक एंटीडिप्रेसेंट्स. तो मैकेनिज्म है फर्स्ट इज बाय ब्लॉकिंग NET नॉरएपिनेफ्रिन ट्रांसपोर्टर, SCRT serotonin transporter located in neuronal and the platelet membrane. And second, it blocks the ACH alpha and H1. Then pharmacological actions: CNS in the normal अगर हम देंगे तो क्या करेगा? टायर्डनेस, क्लमजी फीलिंग, लाइट हेडेडनेस, difficulty in concentrating, unsteady gait, no mood elevation, and unpleasant feeling, right? But in the depressive patient, it will be causing 2-3 weeks prolonged therapy will be there, and there will be increase in the mood, or the mood is gradually elevated. Then become more communicative, they start taking interest in surrounding. So these are not euphorians, so they will be only acting like antidepressants. And night awaking are reduced and night doses produced desynchronization. TCAs lower the seizure threshold and produces convulsions in overdosage. And clomipramine and bupropion have highest seizure precipitating tendency. And ANS की अगर मैं बात करूँ, then anticholinergic blocking side effects are there, and like dry mouth, blurring of vision, urinary retention, constipation. On CVS, there will be tachycardia, postural hypotension, arrhythmia, and ECG changes like T-wave suppression. Pharmacokinetics में good oral absorption is there, highly bound to plasma protein, extensively metabolized in liver, demethylation, oxidation, and glucuronidation. And adverse effects की बात करूँ तो dry mouth, bad taste, urinary retention, constipation, weight gain, sedation, sweating, seizure threshold is lowered, postural hypotension, sexual distress, arrhythmia, and rashes and jaundice. Then acute poisoning of TCA, usually self-attempted suicide, and manifestation is excitement, delirium, anticholinergic effects, muscle spasms, convulsions, coma, respiration is depressed, and body temperature is decreased, and BP is also lowered, and the patient will be having tachycardia as well. So these are the manifestation of the acute poisoning of the TCA: excitement, delirium, anticholinergic effect, muscle spasm, convulsion, coma, respiration, and body temperature decrease हो जाना, BP decrease हो जाना, and tachycardia हो जाना. And the treatment of the acute poisoning: first is maintain the ABC, second is do the gastric lavage, 3 is respiratory assistance, 4th is fluid infusion, then maintain the BP, because there will be decrease in the BP. So first of all, maintain the BP. Then due to the respiratory depression, there will be acidosis, and this acidosis can be corrected by the bicarbonate infusion. And diazepam when injected IV to control conversion and delirium. And lidocaine and propranolol they cause cardiac arrhythmias, so they are used for the treatment of the cardiac arrhythmias if cardiac arrhythmia is there. Then but class IA, IC, antiarrhythmics, and digoxin, they are contraindicated. And then non-selective reuptake inhibitors, SNRIs, so they also increase the Na and the 5-HT both, and they are indicated for the severe depressions, and they are called as second generation antidepressants, and they should be avoided in hypertension, angina, and MI. So first is venlafaxine and desvenlafaxine. So this is having the fastest onset, and it is indicated in the mood changes, hot flashes in menopausal syndrome, social anxieties, and eating disorders. Side effects की अगर बात करूँ तो nausea, sweating, anxiety, dizziness, and impotency. Milnacipran and levomilnacipran, and so this is same as venlafaxine and desvenlafaxine. Then duloxetine is used in diabetic neuropathic pain, stress urinary incontinence, maintenance therapy in the panic disorder, and fibromyalgia. And side effects are lesser sexual problem plus GI tolerance. and these are having lesser side effects than TCAs, right? Lesser side effects than TCAs. Then selective serotonin reuptake inhibitors, SSRIs. So they are indicated or they are drug of choice for the mild and moderate depression. They are drug of choice for all the neurotic disorders. And drugs की बात करूँ then fluoxetine, paroxetine, fluoxamine, sertraline, citalopram, escitalopram and duloxetine. So these are the drugs for premature ejaculation. And side effects की बात करूँ then nausea, anxiety, CNS, headache, bad dreams, sexual and delayed ejaculation, discontinuation syndrome and delayed action is there. Then safer and better accepted and produce little or no sedation and no cognitive impairment. And SSRI and NSAID, they increase the gastric blood loss. Serotonergic syndrome, serotonergic drug is there and SSRI, and monoamine oxidase inhibitor, tramadol and pethidine. Then agitation, restlessness, rigidity, hyperthermia, sweating and twitching, followed by the convulsions. Then fluoxetine, longest acting and approved for the depression in the children more than 7 years, plus OCDs. Side effects are agitation and dermatological reaction. Then fluoxamine are having shorter acting, and they are indicated for the generalized anxiety disorder and OCD. And side effects are nausea, dyspepsia, flatulence, nervousness and discontinuation reaction. Then sertraline, they are indicated for the juvenile depression and post-traumatic stress disorder, and the sertraline is a longer lasting drug. Duloxetine is used for delaying the premature ejaculation, and it is also rapid action, and इतना ज़्यादा rapid है कि before the sexual intercourse, 1 hour before the sexual intercourse you have to take this drug, and that will delay the premature ejaculation. And side effect: nausea, vomiting, loose motion, headache, dizziness and insomnia. And uses of the SSRIs. SSRIs are indicated first choice drug for OCD, obsessive compulsive disorder, panic disorder, social phobia, eating disorder, premature dystrophic disorder, post traumatic stress disorder, anxiety disorder, body dysmorphic disorder, compulsive buying, kleptomania, premature ejaculation, post-MI patient, increase the work capacity and elevation in the mood, and atypical antidepressants, and the drugs are BAT, MAM. So atypical antidepressants, so drugs are BAT, MAM, bupropion, amitriptyline, tianeptine, mirtazapine, amoxapine, atomoxetine and mianserin. And bupropion is an anti-smoking drug as well. Amitriptyline and tianeptine, they increase the reuptake of 5-HT, and amoxapine is a D2 blocker, and atomoxetine is used in ADHD. And bupropion increases the dopamine and NA, and it is excitant and sustained release formulation in smoking cessation. Nicotinic withdrawal symptoms are less with the bupropion, and it is contraindicated in the eating disorder and bipolar disorder. साइड इफेक्ट की बात करूँ, इंसोम्निया, नोजिया, ड्राई माउथ एंड एजिटेशन, एंड ओवरडोजेस में इट कैन प्रोड्यूस सीजर्स एज वेल, राइट. देन एमोक्सापिन इज़ अ D2 ब्लॉकर एंड NA को बढ़ाता है ये, and it is related to the antipsychotic drug and antidepressant and neuroleptic symptoms, and extrapyramidal side effects are there, EPS are there, and overdoses में it can cause status epilepticus because काफ़ी ज़्यादा deficiency cause कर सकता है ये dopamine की. Then mirtazapine, NA and 5-HT दोनों को बढ़ाता है in the synapse, and block the alpha 2 and 5-HT 2, 3, 4 receptors, and noradrenergic and specific serotonergic antidepressant है ये NSSA, and there is selective enhancement of 5-HT1 receptor and has lesser sexual side effects. Side effects are weight gain and increased appetite. Then escitalopram, it blocks the NMDA receptor of glutamate and nasal spray for depression. And brexanolone and allopranolone, it is approved for the postpartum depression and uses of the atypical antidepressant. So and indications are endogenous depression, OCD, ADHD, anxiety disorder, neuropathic pain, premature ejaculation, smoking cessation, enuresis, that is more than 5 years of age, and imipramine 25 mg bedtime, and migraine, pruritus, topical doxepin, एंड बाइपोलर डिसऑर्डर के अंदर बेसिकली मूड स्विंग्स होते हैं. सो पहले मेनिया होगा, देन डिप्रेशन होगा, एंड डिप्रेशन होगा, देन मेनिया होगा, देन डिप्रेशन होगा, देन मेनिया होगा, देन डिप्रेशन होगा. सो मेनिया, सो ये साइक्लिक चेंजेस आते रहते हैं मूड में. सो मेनिया के अंदर अगर है तो ड्रग ऑफ चॉइस इज लिथियम एंड मेनिया प्रोफाइलैक्सिस के लिए. And anti-epileptic drugs, valproate, carbamazepine, topiramate for the rapid cyclers, and antipsychotics में drug of choice for the bipolar in pregnancy, and as lithium is contraindicated in pregnancy. Then depression में first is lithium for the prevention of depression, only drug to prevent the suicidal risk in the bipolar patients. Then lamotrigine, and basically lithium is beneficial for both mania and depression, right? And wait a second. So now we will be studying anti-anxiety drugs. So this is a very important topic. Wait a second. So anti-anxiety drugs. Wait a second. So guys, right now there is an emergency and I have to go. So I think I should end the session here, and I'll be meeting soon. Thank you for being here, and we'll be continuing this session tomorrow. And bye guys. इसी को कंटिन्यू करेंगे. बट वेट अ सेकेंड, थोड़ा सा रुकता हूँ मैं. चलो रुको, जान